Elvik Maharaj for the opposition's response. I next call on the Minister for Women, Children and Social Protection, the Honourable Sashi Kiran, to deliver her statement.
Honourable Speaker, Honourable Prime Minister, Honourable Ministers, Assistant Ministers, Honourable Leader of Opposition, Honourable Members, those who had joined us in public gallery, and people of Fiji joining us online. Ms. Ayandra Vinaka. May I first offer my congratulations to our new Minister for Information, Honourable Linda Tambuya, Minister for Agriculture, Honourable Tomasi Tunambuna, and Assistant Minister, Honourable Inosi Kurindani. I also wish to pay tribute to George Fiji Veikoso, someone who grew up in a broken family in Raiwanga and went on to become a legend, a lesson for many of us who work with children at risk on the potential of our young. May his grieving family and fans find peace during this sad loss. Mr. Speaker, I wish to update this House on the work of our ministry to support people living with disabilities in partnership with National Council for Persons with Disabilities, NCPD, Organizations for Persons with Disabilities, disability service providers, and development partners. To provide some context on disability, Mr. Speaker, the 2017 National Census found that there were 113,595 persons above the age of 5 years old with some degree of disability, or 14.3% of our population. The incidence of disability in the population is likely to have increased since, as Fiji has one of the highest rates of non-communicable diseases in the world, in particular diabetes and stroke. Fiji has a prevalence of diabetes of 16% compared to a global average of 8.5%, leading to amputations as well as blindness. In CWM alone, there is an amputation every 8 hours. That is 3 persons who could lose a limb a day, Mr. Speaker. There is also a high rate of accidents in Fiji which result in injury and disability. The population of Fiji is gradually aging, and as most disabilities occur in older age groups, this will increase the overall prevalence of disability. Mr. Speaker, sir, to provide a comprehensive framework for disability equity and rights and to help improve the quality of life for persons with disabilities, Disability Policy 2008-2018 has been reviewed through consultations around the country in 2023 and 2024. On 4th June 2025, Cabinet endorsed the Fiji Disability Policy and its implementation plan, a key milestone for inclusive governance. The Fiji National Policy on the Rights of Persons with Disabilities 2025 to 2035 is for all stakeholders who aim to improve the lives of persons with disabilities through a human rights-based approach. This approach has replaced the medical model, which focused on persons' impairments, and the charity model, which saw persons with disabilities as objects of pity and charity. The human rights-based approach moves away from viewing persons with disabilities as objects of charity, medical treatment, and social protection towards viewing persons with disabilities who have rights, are capable of claiming those rights and making decisions for their lives based on their free and informed consent, as well as being active members of the society. The engagement of persons with disabilities and their organizations is central to this policy, both in its formulation as well as in its implementation and monitoring. The principle of nothing about us without us is a central value of organizations of persons with disabilities, and indeed of this policy. Disability service providers are affiliates of the National Council for Persons with Disability, and they are all vital actors in this policy implementation, Mr. Speaker. The National Council of Persons with Disabilities was established under the Rights of Persons with Disabilities Act 2018 and falls under the responsibility of our ministry and coordinates organizations of persons with disabilities, disability service providers, and it will ensure the implementation of the National Disability Policy. The NCPD also coordinates advisory committees of different sectors of the government. These committees comprise of government ministries and departments, statutory bodies, CSOs, and OPDs, each headed by a relevant permanent secretary. Mr. Speaker, the revised policy takes its primary guidance from the United Nations Convention on the Rights of Persons with Disabilities that the government of Fiji ratified in 2017. The CRPD provides a comprehensive human rights-based framework to ensure the protection, promotion, respect, and fulfillment of the rights of the persons with disabilities. The revised policy ensures that disability is mainstream across all government and private sector through mechanisms such as sectoral advisory committees and district-level coordination. The strengthening of the existing mechanisms will also ensure that the policy is implemented and will help achieve the disability target outputs mentioned in the Fiji National Development Plan and Vision 2050 is achieved. The revised policy has 13 priority areas, Mr. Speaker: coordination of the policy and mainstreaming, advocacy and awareness, data and research, health and well-being, education and training, employment and economic security, promoting the rights of women, children, youth, and older persons living with disabilities, accessibility, access to justice, social protection and housing, assistive devices and technology, sports and recreation, disaster risk reduction, and climate change. Much of the work is continuing not only through our ministry but also through collaboration with relevant ministries in partnership with Fiji organizations for persons with disabilities. Mr. Speaker, the ministry is working with the Australian government through Department of Foreign Affairs and Trade, DFAT, to carry out capacity assessment for the disability sector, beginning with the structural review of the National Council of Persons with Disabilities. This will address capacity gaps to clearly demarcate roles between NCPD and the ministry, and to work towards the review of the current Rights of the Persons with Disabilities Act, hopefully by 2027. I would like to thank Fiji Bureau of Statistics and the Secretariat of the Pacific Community, SPC, for publishing the 2023 Fiji Disability Monograph, which has been recognized as a lead published article on disability services in the Pacific. The Ministry is using the recommendations of this published research to map the way forward in all the 13 strategic areas of the policy, to ensure credible data is used for informed policy decisions. Disability data informs service planning and delivery and can highlight discrepancies and inequities in terms of access to services. Government ministries and statutory authorities, including the Land Transport Authority and the National Disaster Management Office, need data on the number of persons with disabilities in different areas so that they can provide relevant services. In addition to the need for the data at the national level, both the SDGs and the CRPD require the collection of high-quality, accessible, timely, and reliable data disaggregated by disability. The disability data would make such information readily accessible. Mr. Speaker, with the assistance of DFAT, there is work on building centralized data hub for disability. At present, all ministries and disability service providers collect disability data in different forms for global regional reporting requirements for their relevant ministries or donor-funded programs. Centralized data hub will harmonize these efforts. Mr. Speaker, sir, the social protection plays a key role in realizing the rights of persons with disabilities of all ages and is precondition to equity and inclusion, providing an adequate standard of living, a basic level of income security, thus reducing levels of poverty and vulnerability. To demonstrate government's commitment, the 2025-2026 national budget includes a 5% increase in the disability allowance scheme at an estimated 18.5 million. For this month's payout, August, an estimated 14,000 disability allowance recipients will receive this increase. Social assistance is provided to the most vulnerable communities, including women, children, persons with disabilities, and older persons. A total of 107,599 beneficiaries are supported through the four main programs, namely the Family Assistance Scheme, Care and Protection Program, Disability Allowance Scheme, and Social Pension Scheme. The highest percentage of individual support is provided through the older persons, aged 65 years and above, and persons with disabilities, which combined make 66% of the total beneficiaries. The 2017 census showed that disability occurs more frequently in the population from the age of 55, and it increases dramatically from the age of 70. This is also the age group where disabilities are rapidly increasing and lowers the quality of life. In addition to the above, the Transport Assistance Scheme provides an additional monthly cash top-up of $26 to all persons with disabilities who qualify for Disability Allowance Scheme and eligible Social Pension Scheme beneficiaries aged 70 years and above. This is to assist them to travel in their preferred and accessible mode of transport. Mr. Speaker, the Ministry continues to deliver its services through an integrated and inclusive approach. We are piloting economic empowerment of the beneficiaries of social protection programs. This includes providing business skills training, project materials to eligible beneficiaries either individually or in groups, cooperatives or through institutions. 34 single mothers, many with children with special needs at Korepita Model Town in Lautoka have been beneficiaries for setup or scale-up of their small enterprises. These micro-enterprises allows flexibility of caregiving, yet is developed to improve income of the beneficiaries. Mr. Speaker, many children after completing their education at the special schools lack employment opportunity. So we have developed a bakery and sewing center at the National Council for Persons with Disabilities in Lautoka and are working with a similar project for Suva. Under the pilot Cash Transfer Anticipatory Action and Parametric Insurance Program, selected beneficiaries from both the Disability Allowance Scheme and Eligible Social Pension Scheme are listed for assistance if the payout activation triggers are met. Mr. Speaker, the Disability Disaster Risk Reduction Toolkit is currently under review in partnership with UN Women's Resilience to Disaster Program, Fiji Disabled People's Federation, and with technical assistance from the National Disaster Resilience Management Office. The Ministry and the disability sector are looking forward to this tailor-made toolkit for people with disabilities, which should be ready by the end of this financial year. The Fiji National Gender Policy 2015, which is due for review, and the 2022 Fiji Country Gender Assessment recognized the intersection of a discrimination which can arise from being a woman and having a disability. Abuse, violence, and harassment for women with disabilities are prevalent, including sexual abuse and rape. While the Fiji National Action Plan to Prevent Violence Against Women and Girls 2023 to 2028 has an inclusive approach towards women with disabilities, we need the whole-of-community approach to protect our women and girls living with disability from abuse and sexual violence. Mr. Speaker, our ministry also coordinates 18 district committees on disability that operate throughout Fiji and brings together government ministries and other stakeholders to discuss matters pertaining to disability. This allows for the voices to be heard from the districts and services to be taken all the way to the grassroots. The coalition government is committed to policy implementation for active participation, economic empowerment, independence, and social inclusion of all people living with disabilities. We will continue to empower persons with disabilities through the realization of their human rights and the creation of an equal, peaceful, barrier-free, and inclusive society for all. Thank you, Mr. Speaker.
Thank the Honourable Sashi Kiran, the Minister for Women, Children and Social Protection.